obviously in the midst of a healthcare crisis in this country with spiraling costs, and we're told 40 million Americans with no health insurance. Can you encapsulate the problem as you see it for us, and why you believe that socialized medicine is the wrong route to take?
You know, the American people really, they do believe that we have problems in our health sector we need to fix. But 82% of Americans are satisfied with the health coverage and the health care that they get. We've got to fix this problem for the uninsured, but solving it by transforming our whole healthcare system and putting it under the total control of the government is so much the wrong way to go. Already, the government controls 50% of our health sector. And with the changes just in the last month that this Congress has passed and the Obama administration has proposed are going to dramatically take us in the direction of much more government control of our health sector. That's not what the American people want. They want control over their physicians and their doctors. They want portability of health insurance. They want a choice of private health insurance that's catering to their needs, not some bureaucrat in Washington. I believe that we're on the side of the American people. We've got to do a better job of getting that message out because people are scared. But if we tell them, we're going to give you more choices, more options, portable health insurance, and we're going to help the uninsured to get coverage, I believe they'll be with us.
78 million baby boomers are retiring at a rate of 10,000 a day, scared to death about our health care system, afraid that one day they'll wake up and not be able to afford their prescriptions or doctor's care. What do you say to the aging in this country about the health care crisis?
Well, once again, if we provide subsidies for people to buy private health insurance, if we give private health insurance companies a greater incentive to provide that health coverage and give people a safety net, then I believe we can solve that targeted problem. But the most important thing to think about it over the long term is to give people portable health insurance so they don't have to lose their health insurance if they retire early from a job. So they can keep that coverage. They should even be able to keep it into when they age into Medicare. There's no reason when you turn 65 that you should have to lose private health insurance. People should be able to continue to have choices and control and, importantly, ownership of their health insurance policy. That's what's going to give them real security.
One more question. We often hear, excuse me, sir, can you turn that down, please? We often hear that there's better health care in Canada, there's better health care in Great Britain. Most European countries have health care that takes care of people who can't afford full health coverage. What's your answer to that query?
In the UK, in Canada, in many other European countries, they still know that if you want quality health care, the United States is the place you get it. In Canada, people wait in lines for 4 months to be able to even see a physician. It may be many more months before they can see a specialist. People die on waiting lists in Canada that we would not tolerate in this country. Even people who don't have health insurance are guaranteed access to care in the United States. That's really not the case in Canada and in the UK and many other countries where care is limited, especially access to care for really serious medical problems. We do not want to go there. In fact, I do a lot of speaking in Europe, and they look to the United States to think about, to find out what we're doing, what innovations we're providing. We're the medicine chest for the world and providing new medicines, new treatments, innovation, because in this country still, doctors are responding to the needs of patients in general, not completely, but much more than in other countries, rather than to the dictates of bureaucrats. In the UK, for example, the government decided with people having to wait too long in emergency rooms for care. So they directed the hospital administrators to fix that. What did they do? They took the wheels off the gurneys where people were waiting in hallways and emergency rooms, sometimes for days, because then technically that qualified as a hospital bed and not a gurney in an emergency room. So they go through technical changes that don't help patients. What we need is thinking about putting doctors and patients first in our in our sector, which we do more in this country than any other developed country in the world. Build on that, give people more choices, give them portable health insurance, ownership of that in health insurance, a better safety net, and direct help for the uninsured to get coverage. We can solve this problem without putting our whole health sector under the control of government.